Good afternoon, guys. Today I'm going to deal about clinical investigation. So, what are the clinical investigations normally in their hospitals? So, first laboratory. So, everyone knows we can collect CPC, LFT, and we can send the laboratory. So, it's a medical laboratory. It's a clinical laboratory. It's a laboratory is for tested or done to clinical specimen in order to get the information about the health of the patient to identify the diagnosis and treatment and prevention disease. So that causes only we are using for the investigations. So normally different type of medical laboratory is there. So here generally the two section will be there. So autonomic and clinical. Autonomic means that after surgery, that histopathology and cyto, then electromicroscope they will done. This is for normal blood sample, that is clinical pathologies. So clinical pathology what and all come means bacteriology, virology, parasitology, and immunology and mycology. Then clinical, what are the chemistry? Chemistry will come. So biomedical chemistry it will come. So here entomology, toxicologist and enterologist. So hematologist means their automated and manual analyze to the blood cells. So here coagulation and blood bank it's available for hematology department. So genetic means they will study for cytogenetics. So respiratory reproductive biology means someone analyze and sperm bank for use for IVF treatment, assisted for robotic reproductive technologies. Then bacteriology means what are the microorganism is there in body we can find. Okay, the study of bacteria. So here their identification, classification and characterization of the bacterial species they will use. So parasitologist means what is the parasite it's there we can find out. So that is it's available for blood, urine and sputum. So they can their find specific parasite they will find. So virology means then identification of the virus. So here that cerebrospinal fluid and blood urine they will use. Mycology means it's a branch of mycology. It's considered for fungi. Then genetic and biochemical proteins. Then taxonomy. Then human source of tender medicine or food ethics. The either dangerous of the poison of infection. So they can find. Then clinical biometric, the clinical receive the serum or plasma they will use. They will find the serum or plasma, any separate anything is there they can find. So include wide substance means blood sugars, enzymes and hormone they will find. Okay, toxicologist means it's a pharmaceutical, it's a recreational drugs, urine and blood samples they will done. Immunology and serologies. So here antigen antibody transaction of the diagnostics tool. So here compatibilities of transparent organs they will determine. So any organ donation, any organ donations they will also determine. Okay. Then hematologist and blood bank and perform the capability of testing on donor of blood recipients. So, process of blood components and derivatives and products of transfusions and regulated by the FDA since giving a blood considered of a drug. So you need to determine the patient blood type or status and check the antibody is common antigens found. Then RBCs and cross matching they will everything done for blood bank. Then MRI scan. So here magnetic resonance MRI. It's a large magnet and radio waves. It look organs structure inside your body. So any abnormality, say any liver enlargement, so pancreatitis, that is they will find. Okay. So healthcare professional MRI diagnose to the various of conditions. So ligaments, tumors. Usually exam to the brain and spinal cord. Then generally it's a pain free procedures. So CT scan means computerized tomography. It's referred by to the X-rays and computer of generate the cross section views and need to three-dimensional images of the internal organ structure of the body. So this is also pain free. It's a internal organ, bone, soft tissues and blood vessels. They deal with the regular X-rays. So ultrasonography, it's ultrasonography means used to the produce the image to internal organs other and other tissues. The device is called for transducer converts an electrical current into the sound waves which is sent into the body tissues. Then X-ray. X-ray is used for spine, bone and chest and many reasons including the assessment of the alignment of the spine and range of motion of your spine. Then it detect to the presence of inability to the spinal column. Then X-ray do not show soft tissues, particularly they will see the structure only, bony structures and assessment. So this is the for the normal clinical investigation in the hospital side.